welcome everybody. It's so nice to see so many of you in the same room. Obviously my usual audience is in your practices, in your little room where you take your consultations, and I'd often be sat on the edge of the bed just swinging my legs talking to you about the NDPP. So as Scott said, I'm Danielle and I'm the engagement lead for the NDPP for Xyla Health and Wellbeing. So cover all of the Humber and North Yorkshire area. And what I took away from yesterday is that you guys really struggle to find time to do these kinds of referrals. And what I wanted to say at the beginning, before you sort of get lost in the slides, is that I am that resource of time. I can come out to your practice, I can upskill your teams, I can show you where searches are, where referral forms are, help you to identify patients and really be that resource for you. And I know we statistically remember the first 5 minutes of a presentation, so I wanted to get that in right at the beginning, that I am your resource and use me. I've given you all my contact details before I've started, you've all got my card, and I'll be here this afternoon when we're doing the data packs and everything, so please do use me. Next slide, please. So what is NDPP? You're probably all quite familiar with NDPP, but it's the Diabetes Prevention Programme, and it's a lovely partnership between ourselves, NHS England, and the Office for Health Improvement and Disparities. So that brings together the NDPP as you know it. So what is the NDPP structure? This is the question that I always get asked. What happens on the programme? We make a referral, then what happens? So the patient journey, or the service user, as we refer to them once they come to our side, they're referred through by yourself, or they can be accepted via a self-referral with a few details that I'll go into in a moment. They first of all have an initial assessment conversation with us, so that's a 40-minute chat on the phone. At this point, we find out their motivations for joining the programme, we give them all of the information about the programme, and we also iron out any concerns that they might have. So if you're having that conversation at referral and they're saying, you know, oh, I don't know, I'm not very physically active, we can iron out those concerns. So get them through to that first initial conversation with us. We get 40 minutes, you probably get 4 minutes of time with them. So let us have that conversation. If they're motivated to join, we can answer all their questions. They then go through to group sessions. So at their initial assessment, they will either be invited to join a face-to-face group locally in the area of your practice, or they can also be transferred to our digital provider and have a completely digital service, which is provided by Aviva, who you'll hear from in a little while. So they have that option. So the face-to-face commitment doesn't have to be an issue. Again, if they're working, if they can't get out, we have that option of a digital provision as well. We also offer the course in 16 different languages, and this is available via a tailored remote service, so that they would still have consultations with somebody, but over Microsoft Teams, and that would be in the language of their choice. So if you have got anyone from a different language, if you pop that on their referral form, we can obviously accommodate for that as well. So after their group sessions, the group sessions run fortnightly initially, so fortnightly for 6 sessions, and then monthly for 7 sessions. That sounds like a long time. It is a long time. It's 9 months, but we're looking for that long-term change. We're not looking for a quick overnight fix. We're trying to give long-term lifestyle changes, and that takes time. As you know, it's not as simple as eat less, move more, or we'd all be doing it. So we're looking for that long-term commitment, but how you can sort of sell that to your patients is it's 24 hours of contact time spread over 9 months. So that sounds a little bit better than we want you to sign your life away for 9 months. So after their group sessions, they then have an end of programme one-to-one review, where we would kind of follow up on their journey, find out how they've got on, really evaluate their experience, but also this really key point here is to signpost them onto other services. So if there's anything else at that point that they need, they can be signposted on and sent to different services. We have local signposting packs, so we've got lots of information that can help in lots of different areas if that patient then needed further support. Next slide, please. So what the NDPP covers, it's tailored to glucose reduction. So everything that we're doing with the patients is to reduce their blood glucose level and get them back into the normal ranges, fingers crossed. We do that through tailored nutrition advice. We do information and sessions of physical activity. And we also focus on stress management and the importance of quality sleep and how that can also affect your HbA1c. We do this through facilitating the session, so it's very interactive, and patients are asked to commit to small realistic changes that build up over a longer period of time. So we're not asking them to give up everything they enjoy. It's not a strict diet sheet that they're going to have to follow. It's really small, sensible changes that we can all implement just with a bit of motivation. So that's how we structure the sessions. Next slide, please. What our service users have access to has come a long way, as I'm sure Ryan will appreciate. He's been with NDPP right from the beginning. So we've come a long way since the very start, and we've now got access to a whole host of different things. So we've got physical activity videos, as I said, signposting packs. We've got a wellbeing app where we can record progress, and there's lots of links on that app to different physical activity, different information. We get SMS and email reminders. And we do also offer the traditional letter communication as well. We've got an e-learning platform, and like I said earlier, we are available in 16 different languages. So all of our handbooks are also available in those 16 different languages. So I'd like to think we've really thought of it all, but obviously you can give me feedback if you think there's anything else that we could offer that your patients would appreciate. Next slide, please. So why is NDPP important? As a room full of nurses, you probably know all of these scary statistics already, but these are the ones that really can get the patients motivated. So someone is diagnosed with type 2 diabetes every 2 minutes. So if you think about how long I've been rabbling on for so far, there's quite a few 2 minutes gone by. Every 2 minutes somebody is diagnosed. 80% of type 2 diabetes is lifestyle related. So if you think about the things that we're focusing on, all lifestyle elements that we can make small changes to, we could potentially prevent that from happening. It's predicted that there'll be 5.5 million people with type 2 by 2030. So from a practice point of view, your time reviewing those diabetic patients, the costs for those medicines, just the ongoing review and time that takes, that's quite significant. And 3 out of 5 cases of type 2 could have been prevented. So if we can get, more people through the prevention programme, more people taking that motivation to change their lifestyle, we can potentially stop them from becoming type 2 diabetic. Next slide, please. So eligibility criteria. It's quite straightforward, really. We're looking for anyone aged 18 to 80. The over 80s are allowed to join, but we just ask that you outweigh, that the benefits outweigh the risks of them joining the programme. As a result of lifestyle changes, people often lose weight on the NDPP, so we wouldn't want that to cause any further problems if your patient is at risk from losing weight. We need them to have a HbA1c between 42 and 47, or the fasting plasma equivalent in the last 12 months. The only exception to that is that if your patient has a history of gestational diabetes, they are eligible for the programme for the rest of their lives. So it doesn't have to be that they've had gestational diabetes in the last year. It could be baby's now 5 and they've decided, right, I'm going to join now. That's fine as long as they've had a HbA1c reading in the last year. So we just have to know that they're not now diabetic. So even if it's gone back to normal, they can still be referred. Please also bear in mind the motivation to change and the commitment level of that patient. Obviously, we want patients to come through who are motivated, who are going to really want to make that change, who want to know more about NDPP and how it can change their lives. We don't want somebody to sort of sign up because they feel like they had to. Nobody has to. We're not forcing these patients to sign up. We want them to be motivated, and we want to have them on the programme right through to the end and see their success as it should be. So it has to be the right time for that patient as well. Next slide, please. So the referral pathway, when we do the round the table this afternoon, I'll spend a little bit of time with you individually talking about your practices. Some of you have already met and done this in your practices, which is really nice to see some smiles around the room. But with the referrals, it's quite simple. We've got a direct referral form that is in your clinical system. Or you can also ask a patient to self-refer. If you're asking them to self-refer, there is a telephone number and a website that's in our leaflet. If you've not picked up our leaflet, it's on the purple table outside, the purple corner. So patients can self-refer. To do that, they need their HbA1c or FPG reading and the date of that test. And also their NHS number, but that's usually given to them anyway on communications, or if they've got the NHS app, they tend to have access to that number. And they can then self-refer. What I'd also like to mention here is something that I can support you with. So we have got some searches built into the systems, in System 1 and in EMIS, where we can run searches of your system and identify eligible patients. So obviously we want those opportunistic referrals, but what we can also do is mop up the ones that might have been missed, or follow them up if they've been offered and they weren't sure at the time with that search. I'm able to support you to do that, so I can show you where the search is, run it, help you to invite those patients, and please do take me up on that, as I know some of you already have. It can make a massive difference in your uptake to NDPP by offering that support. What we've also got is Medibase here with us, who you'll hear from next. We ran a pilot with Medibase, which allowed us to invite service users by text to the NDPP, and the results from that pilot were phenomenal. So we ran this in 4 practices in North Links and North East Links, and the actual success of the pilot, we had 1,000% more uptake to the NDPP than using the traditional referral methods. So you're going to hear more from Medibase and how that solution's currently being formed and will be offered out to you soon. Next slide, please. So service user outcomes. 70% of service users who are overweight or obese lose weight on the NDPP. So we're not a weight loss programme, but as a result of the changes that they make, patients do lose weight, which we know helps. 39% of completers lose a minimum of 5% of their body weight. There is less than 5% difference in completion rates between ethnic minority groups compared to white ethnic groups. And the mean weight change from programme start to end is 4 kilograms. So pretty good results to say we're just really looking at small lifestyle changes that can add up over time. Next slide, please. My final slide, you're probably glad to know, is how I can support you. So I can't stress enough that I am available to come and support your practices. There's lots of things on there that I can give you, resources, advice, additional support. But what I really want to do is come in and have that meeting with you, show you where the referral forms are, show you where the searches are, help you to identify those patients and really get on top of it, and then put a system in place going forward where somebody in the practice, it doesn't have to be you as a nurse, it can be an admin team member, runs that search and keeps doing that mop-up so that we're really covering all bases. So please do link in with me this afternoon. Myself and Ryan will be here to give you individual practice information. And I've got a clipboard out on my purple table. Please put your details on there if you'd like me to make an appointment with you. Thank you very much for listening.